I've used other autologous fillers in my practice, and I love the idea of using something that is more natural, and I think patients are really gravitating to things that are not fillers per se, but they're interested in more natural results. And so that was a very big part of our practice. We noticed post-COVID, people were really more aware of what they were putting in their bodies. And having been an injector for a really long time, what we noticed is there was just not a lot of good options for the under eye area. And so that's where Cellenis Derma really shines in our practice. It allows us to treat safely and effectively and consistent results, and we don't have to worry about filler migration there. It also allows us to go into a space that no other filler can go. And so when someone comes in complaining of, dark circles under their eyes or sunken hollows under their eyes, most of those patients are not filler candidates. And so you're only curing their issue for a small amount of time, and then we know that migrates, and so you end up with another problem. And so when you use Cellenis Derma, it does two things. It helps the tissue integrity, it helps strengthen the tensile strength of the tissue, it helps the texture, it gives a luminosity to the skin, but it also serves as this filler. And so when you can do all of those things and have all of that magic happening at once, patients are very, very happy with it.